Bismillahirrahmanirrahim. I am Dr. Rizwan Ahmed. I welcome you all for this very interesting and important clinical and academic topic of metabolic response to trauma or injury. Uh, I have already uploaded a slideshow about this lecture. So kindly, if you go through all slides, that will give you a very good overview about this very important topic of understanding the body response to the trauma or any injury or any clinical insult what an individual come across during an accident or a major operation or major infection. So it's very important to understand the basic pathophysiology of response of a body to any clinical insult, which could be a very minor injury or a minor operation or minor illness, or it could be a extreme form of trauma. Patient or individual could be involved in a polytrauma accident, could have suffered a major burn, and could have suffered a very significant septic or sepsis like a severe pancreatitis. So we just have to understand what physiological pathological changes come in the body metabolism during this clinical insult. So it's a very complex process, what we call it metabolic response to trauma. It involves physiological changes, endocrinological changes, cardiovascular changes, neuromusculoskeletal changes in the body. It changes all the metabolism or mechanism of the body function to go through all this trauma phase. So if kindly because it's just a video link lecture, so it's very important for all of you to go through this slideshow. Kindly read these slides carefully, try to understand them, and then if you can just read an article about metabolic response from your textbook or from a journal, that will give you help in understanding this metabolic response to trauma. That I always tell about, about my lectures, that our medical profession requires a lot of hard work and practice to understand the diseases or their clinical implications and then the treatment. So our main aim of our main goal of educating you or teaching you yourself or myself, we all need a lot of hard work, practice, and repetition. So in to provide good clinical or medical care to the public, it's very important to understand the basic pathophysiology of any disease. So kindly go through my slideshow, try to understand what metabolic response to trauma or injury is, and then it has different phases. So try to understand each phase. Because nowadays, with all this development of intensive care units and all these new gadgetries, new inventions we are getting, we are trying to modulate. We want to manipulate the body response to trauma. That body should not harm itself. To minimize the response, that body should have a preparation to go through all this trauma and to have a better outcome. That is our ultimate goal. In any disease management or any problem we come across, we treat the way that at the end we have a better outcome. So in short, Metabolic trauma, metabolic response to trauma is a very complex physiological mechanism. It involves a lot of endocrinological changes, cardiovascular changes, and neuromusculoskeletal changes. So it starts with ebb phase. It has different phases. Ebb phase, ebb phase is just the initial phase, initial 24 to 48 hours. Ebb means calm, calm before the storm. So body goes very calm. It's called homeostasis phase. Body try to calm down. Just go to the zero level to prevent the catabolism in the body and prepare itself for the events which will come across in next coming days. Then come after ebb phase, then comes the phase of catabolism. The lot of destruction of proteins, lot of nitrogen excretion. So in this phase, body loses protein, and then comes anabolic phase, which is the recovery phase. In comes anabolism. Metabolism increases, protein synthesis increases, and body recovers. So just go through all these changes. In every phase, there is an endocrine change, there is change in the cardiovascular system, there is change in the nitrogen excretion from the body. So all systems, they adjust themselves according to the requirement. So kindly, if you go through this lecture and go through my video, this talk, so I will hope that you will come back to me, and then I can reply your any questions and queries. Thank you.